Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Hello, Mihira. I understand you've been experiencing some troubling symptoms. Could you tell me what's been going on?
Yes, thank you, Dr. Daniel. So my husband has been complaining about my snoring for about 6 months now. At first, I didn't really think much of it, just figured I was tired, But it hasn't improved. In fact, he says it's gotten progressively worse and much louder. He even says I sometimes gasp for air in my sleep, which really scares him.
All right, noted.
And then there's this intense feeling of being absolutely exhausted, even after what feels like a full night's sleep. It's like a heavy, dull ache that just doesn't go away. Sometimes, I wake up with a really dry mouth and a sore throat, which makes it hard to talk for long periods. I also have this strange sensation of being in a fog during the day. My concentration is terrible, and I feel generally irritable. It's all just very frustrating and exhausting.
I see. And Mihira, do you experience these symptoms continuously, or do they come and go?
Well, that's the odd part. Yes, it is pretty constant, according to my husband, but sometimes, especially when I sleep on my back, it feels like it intensifies. I've tried lying on my side or propping up with pillows, thinking it might help, but it only provides minor relief. The snoring seems to worsen when I'm lying flat. There's also the issue of needing to get up frequently during the night to use the bathroom, which further disrupts my sleep. And I forgot to mention, I also have this nagging headache almost every morning. It's mostly dull, but occasionally it's quite sharp.
Thank you, that's very thorough, Mihira. Have you tried any treatments or remedies up until now?
Yes, quite a few actually. At first, I tried over-the-counter nasal strips. Those didn't do much, honestly. Then I moved on to different types of pillows, even a special anti-snore pillow, but after a few weeks, I didn't notice any improvement in my energy levels or the snoring itself. I've also tried avoiding alcohol before bed, and while that sometimes helps a little, it's short-lived.
Right, and how about your medical history, Mihira? Any history of respiratory issues, allergies, or surgeries in the past?
Well, I've had seasonal allergies since I was a teenager, but they're generally well controlled. I've never had any surgeries or major illnesses. I do get stuffy sometimes with the allergies, but this feels different, more persistent and intense, especially the exhaustion.
Thank you for that. From what you've described, Mihira, it sounds like you might have sleep apnea, which is a condition where your breathing repeatedly stops and starts during sleep. It can cause symptoms similar to what you've been experiencing.
I've never heard of that.
To confirm this, I'd like to conduct a few examinations, Mihira. A sleep study would allow us to monitor your breathing, heart rate, and other vital signs while you sleep. Additionally, I may order an examination of your upper airway to look for any obstructions.
Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Hello, Mrs. Mihira. I'm Dr. Eleanor Vance, your physical therapist. Nice to meet you. What brings you in today?
Hello, Dr. Vance. Well, I'm here because I recently had knee surgery, and I'm finding it really difficult to get around my house. My balance isn't great, and I'm worried about falling.
I see. It sounds challenging. Mihira, could you tell me a bit more about how this is affecting your day-to-day activities at home?
Sure. Getting up from chairs, walking to the bathroom, and even just moving from room to room feels incredibly unstable. I have to hold on to furniture, and it takes me ages to do anything. My wife is constantly worried about me.
I understand that must be very frustrating. Mihira, have you tried using anything to help you move around?
Yes, the hospital gave me crutches, but they feel very awkward and I don't feel secure using them, especially on our carpet. I tried them for a bit, but I just don't feel confident.
Thank you for sharing that, Mihira. Have you experienced any other issues since your surgery, or has your mobility been consistently difficult?
Well, the pain has definitely improved, but this lack of stability is persistent. It feels like my knee might give out, especially when I'm tired. I really want to get back to my daily walks, but right now, even a short trip to the kitchen feels like a major effort. I'm also a bit hesitant to put full weight on my knee, even though the surgeon said it's okay.
That's helpful to know. Based on what you've told me, and considering your recent surgery and concerns about balance, I'd like to assess your current mobility and strength today. This will help us determine the best assistive device for you.
All right, that's fine.
Mihira, for selecting appropriate support or therapy, we'll also observe you walking to see your gait pattern and balance.
That makes sense. I just want to be able to move around safely and feel a bit more independent.
Absolutely, Mihira. Once we understand your needs, we can create a personalized training plan. We'll observe how you move in different settings and note any signs of discomfort or instability. This allows us to tailor interventions that truly support your recovery. For post-surgical mobility and balance issues, we often find that a rollator walker can be very beneficial. It offers more stability than crutches and has wheels, which can make moving around easier.
Is that easy to use? And will it help me get around my house without tripping?
Generally, yes, it is quite user-friendly. We'll start by practicing how to properly adjust it to your height, how to walk with it safely, and how to navigate different surfaces, including your carpet. We'll then focus on gait training techniques to ensure smooth, coordinated movement and reduce compensatory patterns.
Yes, I wish to get sufficient training.
Of course, Mihira. In addition, we'll incorporate proprioceptive exercises to enhance your body's awareness in space, which is crucial for preventing falls. These activities will also help retrain your neuromuscular coordination, which may have been affected by recent surgery or immobility. We'll also work on strengthening exercises for your legs to improve your overall balance and confidence over the next few weeks.
I understand. Thank you for explaining everything so clearly, Dr. Vance.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Question 25. You hear a doctor called Mihira talking to a junior doctor. Now read the question.
Dr. Mihira, thanks for taking the time. I'm reviewing the new patient communication protocols, and I wanted to clarify a few points about effective patient engagement, especially with the more complex cases we're seeing.
Of course, Eleanor. It's crucial we get this right. We've had a few instances lately where critical information wasn't adequately absorbed by patients, leading to readmissions. Remember Mr. Henderson, the post-op patient who misunderstood his wound care instructions? Or Mrs. Davies, who didn't grasp the nuances of her medication schedule despite us reviewing it twice?
Yes, I recall those. I'm finding it particularly challenging with patients who have multiple comorbidities, as the sheer volume of information can be overwhelming for them. I sometimes wonder if we're overloading them or if our language isn't always accessible.
It's not just about what we say, but how we say it, and more importantly, how we ensure it's retained. We've tried simplified pamphlets and even short video demonstrations, but the consistent feedback points to a need for more active reinforcement. For instance, when explaining a new medication, instead of just listing side effects, we need to ask them to rephrase what they understand, or perhaps even demonstrate how they'll take it. It's the constant checking for understanding, not just a one-time explanation, that truly makes the difference. This proactive approach helps to flag misunderstandings early. We also need to empower them to ask questions without feeling rushed. It's less about the quantity of tools and more about the quality of the interaction.
So, Mihira, it's about shifting from simply delivering information to truly confirming comprehension and encouraging active participation. That makes sense. I'll focus on incorporating more teachback and open-ended questions.
Exactly. And remember, a patient who feels heard is a patient more likely to adhere.
Question 26. You hear a head nurse called Mihira talking to a doctor. Now read the question.
Mihira, I've just seen the weekend roster. We're short on surgical nurses again?
Yes, doctor. We had 2 resignations last week, plus Ellie is on indefinite leave due to her mother's condition. That's left us scrambling to fill critical gaps, especially in post-op.
Didn't HR confirm replacements?
They did, but 2 of them declined after orientation. Apparently, the night shift structure is too demanding, and the overlapping cover for ICU isn't well explained.
And I assume that's affecting recovery times?
Precisely. Without consistent post-op staff, we're delaying patient mobilization. I flagged it with admin, but they're prioritizing the pediatrics wing expansion instead.
So your request for float nurses was denied?
Not denied, just deferred. They've redirected agency staff to A&E due to the rise in trauma cases, completely ignoring the cascading impact here.
Mihira, this is going to compromise outcomes if it's not addressed.
Agreed. I've drafted a second escalation memo, focusing on post-op recovery metrics. If that doesn't get traction, we'll need to revise weekend discharges again.
Question 27. You hear a physiotherapist called Mihira talking to a doctor. Now read the question.
Mihira, I've reviewed your equipment request, but we need to prioritize. The tilt tables and parallel bars are both overdue for replacement, which is more urgent.
The parallel bars are critical, they're unstable, and 2 patients fell last week. The tilt tables are shaky but still functional if supervised.
Budget's tight. The ultrasound therapy machine also has a faulty probe. Could that wait?
Not really. Without the probe, we're relying on manual therapy, which delays recovery for post-op patients. But the bars are a safety risk, we'd need to suspend gait training entirely without them.
What about the TINS units? Mihira, the wires are frayed, but nurses say they're manageable.
They're manageable for now, but if those fail mid-treatment, patients lose pain relief mid-session. Still, the bars take precedence, we can't risk another fall.
Understood. I'll approve the bars first, then the ultrasound probe. The rest will have to wait.
Question 28. You hear a surgeon called Mihira talking to a GP. Now read the question.
Mihira, I've gone through your surgical equipment requests. The laparoscopic set and the harmonic scalpel both need upgrades, which takes priority.
The harmonic scalpel is failing intermittently. Last week, it overheated mid-procedure, forcing us to switch to manual techniques. The laparoscopic set has dull graspers, but we're managing.
What about the sterilizer? The cycle times are inconsistent, delaying surgeries. That's a bottleneck, but we've adjusted schedules. The scalpel is riskier. If it fails during a delicate dissection, we risk uncontrolled bleeding. And the suction unit? The pressure fluctuates, but nurses say it's workable. It's barely workable. But unlike the scalpel, it won't compromise patient safety, just slows things down. One more scalpel malfunction, and we're looking at a major intraoperative complication. Right. Mihira, I'll fast-track the scalpel, then reassess the sterilizer next month. The rest will have to wait.
Question 29. You hear a doctor called Mihira talking to a pharmacist. Now read the question.
John, good afternoon. I'm calling about Mrs. Albright, the patient with the challenging polypharmacy case. Her latest blood work showed a concerning rise in her INR, and I'm trying to pinpoint the interaction. She's on warfarin, of course, but also an escalating dose of amlodipine for her blood pressure, and her new rheumatologist started her on celecoxib for her arthritis last week.
Ah, Mrs. Albright. Yes, I saw that prescription for celecoxib come through. My initial thought was the obvious NSAID-warfarin interaction, but her INR was stable before the celecoxib, and she's quite compliant with her diet. Have we considered the amlodipine? While not a primary interaction, some reports suggest it can subtly alter warfarin metabolism in sensitive individuals, though it's usually less pronounced than an NSAID.
That's a valid point, John, and one I hadn't entirely dismissed. However, the timing of the INR spike aligns more closely with the initiation of the celecoxib. What concerns me is her other medication. She also takes a daily herbal supplement, St. John's wort, for mood, which she's been reluctant to stop. While St. John's wort typically reduces warfarin efficacy, making the INR drop, the unpredictable nature of herbal interactions, especially when multiple drugs are involved, can sometimes present atypically. My hypothesis is that the cumulative effect of the celecoxib's direct antiplatelet effect, combined with the subtle metabolic strain, potentially exacerbated by the St. John's wort's presence, is what tipped her over. The most pressing issue here, beyond identifying the exact culprit, is ensuring the patient's immediate safety and adjusting her warfarin.
I agree. The St. John's wort is indeed a wild card, especially given its varied effects on cytochrome P450 enzymes. I'll cross-reference the batch of celecoxib she received and also speak to her about discontinuing the herbal supplement immediately. We can then cautiously adjust her warfarin and monitor closely.
Perfect. Let's aim to recheck her INR in 48 hours.
Question 30. You hear a GP called Mihira talking to a surgeon. Now read the question.
Mihira, I saw your requisition form. You're asking for both laparoscopic kits and a replacement arthroscope?
Yes, Alan. The laparoscopic kits are outdated, half of the trocars are missing caps, and the scopes fog up mid-procedure. As for the arthroscope, the image distortion has worsened since last month.
But weren't new kits ordered 6 months ago?
That was for general surgery. Orthopedics didn't get any updates. Plus, the newer kits are locked in the teaching suite and rarely available during peak lists.
I see. I assume this has already affected your surgical outcomes?
Not directly, but it's slowing procedures. More time under anesthetic increases post-op fatigue, and in some cases, patients had to be rescheduled because the image resolution was unusable.
And the administration?
They're reviewing capital expenditures, but the focus is on the new maternity ward. They've asked us to consolidate equipment between theaters, which only adds to delays.
That's not sustainable, Mihira.
Exactly. If this persists, we'll need to reduce elective caseloads until we have reliable access to functioning scopes.
Part C. Extract 1. You hear a psychiatrist, Mihira, and an interviewer discussing exam stress.
Welcome, Dr. Mihira, a distinguished psychiatrist with extensive experience in adolescent and young adult mental health. Dr. Mihira, thank you for joining us.
It's a pleasure to be here. David.
Let's begin by understanding the roots of this phenomenon. Mihira, what, in your professional opinion, are the primary drivers behind exam stress?
Well, David, the origins are multifaceted. At its core, exam stress often stems from an intense fear of failure, coupled with societal and parental expectations that place an immense premium on academic performance. There's also the pressure of competition, the drive to outperform peers, which can be debilitating. Furthermore, a lack of perceived control over the outcome, even when students have prepared diligently, can be a significant contributor. They might feel that despite their efforts, a single bad day or an unexpectedly difficult question could derail their aspirations, leading to significant anxiety.
That makes perfect sense. And the data, it seems, supports the notion that this issue is escalating. Mihira, why do you believe we're seeing such a marked increase in reported cases of exam stress in recent years?
The numbers are indeed concerning. One major factor is the increasingly competitive academic landscape. University admissions are more rigorous, and the perceived link between higher education and future success has never been stronger. This magnifies the stakes. Additionally, the constant bombardment of information and comparison through social media can create a skewed perception of achievement, leading students to feel perpetually inadequate. The digital age, while offering resources, also presents an endless feed of idealized academic journeys, which can exacerbate feelings of inadequacy and pressure to excel.
Fascinating insights. You must have encountered numerous cases. Mihira, could you perhaps share an example of a particularly remarkable patient who struggled significantly with exam stress and how their journey unfolded?
Certainly. I recall a young man named Ryan, an exceptionally bright student who, despite consistently high marks, developed severe panic attacks before major exams. He would experience nausea, dizziness, and a complete mental block. His parents, initially dismissive, eventually brought him to me. Ryan's perfectionism was crippling. He couldn't tolerate the slightest error. Through a combination of cognitive behavioral therapy, where we challenged his irrational fears, and mindfulness techniques, he gradually learned to reframe his thoughts about failure. The turning point was when he realized that his self-worth wasn't solely tied to his grades. He started incorporating short breaks during study sessions, which was revolutionary for him, and slowly, his performance began to reflect his true capabilities, free from the shadow of paralyzing anxiety.
Ryan's story offers hope. For those currently grappling with exam stress, Mihira, what practical strategies would you recommend for managing it effectively?
Effective management involves a holistic approach. Firstly, establishing a balanced study routine that incorporates regular breaks, adequate sleep, and physical activity is paramount. Secondly, developing realistic expectations and focusing on effort rather than solely on outcomes can significantly reduce pressure. Mindfulness exercises, deep breathing techniques, and even short meditation sessions can be incredibly beneficial for immediate anxiety reduction. Furthermore, encouraging open communication with parents, teachers, or trusted friends about their feelings can provide vital emotional support. It's about building resilience and understanding that occasional setbacks are part of the learning process.
Many listeners might wonder about pharmacological interventions. Mihira, how effective are medication and other professional treatments in addressing severe exam stress?
For severe cases where stress manifests as clinical anxiety or depression, medication can be a valuable short-term tool, often alongside therapy. Anxiolytics or antidepressants, under strict medical supervision, can help stabilize mood and reduce debilitating symptoms, allowing the individual to engage more effectively with therapeutic interventions. However, medication is rarely a standalone solution. Cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, are highly effective in equipping individuals with coping mechanisms and changing maladaptive thought patterns. The goal is to empower the patient to manage their symptoms independently in the long run, not to create dependency on medication.
Finally, Mihira, how crucial is patient education in this context, and what role does it play in long-term prevention and management?
Patient education is foundational, David. It's not enough to simply prescribe a treatment. Patients need to understand why they feel what they feel and how the recommended strategies work. Educating them about the physiological responses to stress, the cognitive distortions that fuel anxiety, and the benefits of self-care fosters a sense of agency. When patients are informed, they become active participants in their recovery rather than passive recipients of treatment. This understanding empowers them to identify early warning signs, implement preventative measures, and advocate for their own well-being, leading to sustained mental health and better academic outcomes.
Dr. Mihira, thank you for these invaluable insights. It's been a truly enlightening discussion.
Extract 2. Questions 37 to 42. You hear a head nurse talking about vaccination day at the Mihira Research Institute.
Good morning, everyone. As head nurse here at Mihira Research Institute, it's a distinct pleasure to address you today about a critical aspect of our public health commitment, our vaccination days. These are not merely events. They are meticulously orchestrated efforts to safeguard community well-being, and at Mihira Care, we pride ourselves on setting the highest standards for their execution. Let's first delve into the atmosphere of a typical vaccination day. Imagine, if you will, a vibrant yet orderly hum. The Mihira Care Vaccination Hall, usually a serene space, transforms into a hub of controlled activity. There's an undeniable buzz of anticipation, a mixture of mild apprehension from some of our younger or more needle-averse visitors, and a pervasive sense of purpose among our staff. It's an environment where efficiency meets empathy, where the swift movement of patients through designated stations is balanced by the calming presence of our dedicated nurses and volunteers. The air is often punctuated by the soft murmur of conversations, the occasional playful distraction for a child, and the reassuring tones of our team members guiding individuals through the process. It's a testament to the seamless coordination that underscores every Mihira Care initiative. The preparations for such a monumental undertaking begin long before the first syringe is unpacked. Weeks, sometimes even months, in advance, our logistics team at Mihira Care meticulously plans everything from vaccine procurement and cold chain management to the optimal layout of the vaccination stations. We conduct rigorous checks of all equipment, ensuring every auto-disable syringe is accounted for, every sharps container is correctly positioned, and every resuscitation trolley is fully stocked and accessible. Furthermore, patient information leaflets are prepared in multiple languages, and a robust system for appointment scheduling and queue management is put in place to ensure a smooth flow and minimize waiting times. Every detail, no matter how small, is scrutinized to ensure a safe and efficient experience for everyone who walks through our doors for Mihira Care. Integral to our success is the comprehensive workforce training we undertake. It's not enough to simply know how to administer an injection. Our team members undergo extensive training in patient communication, recognizing and managing adverse reactions, and maintaining impeccable sterile technique. We simulate various scenarios, from managing anxious parents to handling potential allergic responses, ensuring every individual on our team is prepared to act decisively and calmly under pressure. This goes beyond the clinical. It extends to a deep understanding of the vaccine itself, its indications, contraindications, and potential side effects, enabling our staff to answer patient queries with confidence and clarity. This continuous professional development is a cornerstone of the quality care synonymous with Mihira Care. To support our operations, we have a multifaceted system in place. Electronically, our integrated patient management system allows for real-time tracking of vaccinations administered, efficient record-keeping, and streamlined post-vaccination follow-up. Physically, we establish dedicated observation areas where individuals are monitored for a prescribed period after receiving their vaccine, staffed by nurses trained to identify and manage any immediate reactions. Paramedic teams are on standby for any emergencies, and clear protocols are established for escalation to higher medical care if necessary. Furthermore, a robust waste management system is implemented to ensure the safe disposal of all medical waste, adhering to the strictest environmental and safety guidelines. These supporting systems are the backbone of our efficient and secure Mihira Care vaccination drives. Managing the diverse range of patients who attend vaccination day requires a nuanced approach. For our pediatric population, we employ distraction techniques, such as engaging stories or small toys, and create a child-friendly environment to alleviate fear. For adults who may be needle-phobic, our nurses are trained in empathetic communication, relaxation techniques, and offering privacy during the procedure. We also have dedicated stations and protocols for individuals with specific medical conditions or those requiring additional support, ensuring accessibility and equitable care for all. The ability to adapt our approach to individual needs is a hallmark of the compassionate care provided at Mihira Care. Finally, at the end of a vaccination day, the team, though undoubtedly fatigued, experiences a profound sense of accomplishment. There's a quiet satisfaction that permeates the air, a collective understanding that they have contributed meaningfully to public health. The initial bustle subsides, replaced by the methodical process of packing down equipment, meticulously cleaning and sanitizing the space, and completing the day's documentation. While the physical exhaustion is palpable, it is overshadowed by the knowledge that countless individuals have been protected, and the community has taken another significant step towards enhanced immunity, all thanks to the unwavering dedication of the Mihira care team. It's a demanding day, but one that reaffirms our purpose and commitment to a healthier future.